I would like to thank Mr. Popovsky, Deputy General at Virginia, for accepting our invitation. In the coming minutes, he will join us. I would like also to thank the panelists to do so. We are very, very happy to have you on board. Thanks to the audience, we are many today. And as I said before, there is a tool to make questions along the dialogue that will be answered at the end of this part. Thanks to Ms. Nebreda, Secretary for Foreign Action at the European Union, at the Government of Catalonia, for trusting in the IEMed, in the European Institute of the Mediterranean, to organize this series of dialogues related to its Mediterranean strategy and related to the 25th anniversary of the Barcelona Declaration. I would not say only that. I would like also take advantage of this moment to acknowledge the altruism of the government of Catalonia, the Spanish Ministry of Foreign Affairs, and the Barcelona country, our funders, to create and support on its journey a center, the IEMed, the European Institute of the Mediterranean, not to advocate particularly on their own specific interests, but rather to contribute to the principles and values of the Barcelona process to build a space of peace, stability, shared prosperity, and dialogue between cultures and civilizations in both shores of the Mediterranean. 25 years ago, the IEMed, the European Institute of the Mediterranean, has organized the first civil society forum that was organized in the margins of the ministerial meeting. And in that event, more than 1,000 participants from the whole region attended this meeting. At that time, in 1995, it has been really a novelty, even quite a revolution. And since then, the European Institute of the Mediterranean has constantly supported the civil society, the institutions, and the administration to shape Euro-Mediterranean relations. Intercultural dialogue, women's rights, sustainability, youth, academia, all these things are our core business. This panel, composed by brilliant youth researchers, is a very good example of that, and shows also the IEMed commitment with gender equality and to the new generations. In 1995, many people in Europe, and not only in Europe, thought that there was no civil society as such in the South. We proved they were wrong. Now, once again, in the region, it's time to be bold and brave. Indeed, the pandemic is putting pressure on our countries, in our societies, but working together, we can turn this situation into an opportunity. And we have, I think, two very good tools to accompany this process. The first would be the new financial instrument, the NDICI, and the coming refreshed and readapted EMP. During this exchange, the panelists will expose how we could face all those channels. Thank you very much. Good dialogue. And now, Ms. Nebreda, you have the floor.
Moltes gràcies. Bon dia i moltes gràcies a tothom per haver-vos connectat avui a aquest acte en el marc dels diàlegs Mediterrània més 25. Vull agrair en primer lloc a l'IEMed per l'organització d'aquest seminari sobre l'impacte de la Covid-19 en els països del sud del Mediterrani i la necessitat d'elaborar respostes euromediterrànies a aquesta crisi. I, evidentment, gràcies als ponents que ens acompanyen per enriquir aquest debat. Catalonia and Barcelona have developed as both Mediterranean and European. What we call Mare Nostrum has historically been and will always be a space where different cultures meet, ideas and experiences are shared, and ties are strengthened. Because of this European and Mediterranean commitment, the government of Catalonia has adopted its MedCat 2030 strategy, aiming to contribute to a change in the approach of the Mediterranean project in Europe, strengthen relations and exchanges between actors on both shores, and deploy in the Mediterranean the goals of the 2030 Agenda for Sustainable Development. In the same spirit, of course, the Euro-Mediterranean capital status that Barcelona holds, with the presence of the Secretariat of the Union for the Mediterranean, represents an opportunity to enhance this cooperation amongst countries and territories on the north and south coasts of our sea. In this framework, the government of Catalonia sets the Euro-Mediterranean relations high in its foreign action agenda, prioritizing its relations with its neighbors in the south and in the whole Mediterranean region. We are working to promote values, people, shared prosperity, and interculturality. Focusing on what brings us here today, there is no doubt that the coronavirus crisis has been a turning point for humanity. COVID-19 has challenged and continues to challenge us as a society. It has had a huge impact on us and has made us change many of our modern behaviors. We have also learned not to take everything for granted. We have realized how vulnerable we are, not only health-wise, but also from an economic and social point of view, as we witness and suffer the dramatic consequences of the pandemic. Nonetheless, in the aftermath of this severe crisis, we are also more convinced than ever that the 17 targets set on the Sustainable Development Goals must be our compass to guide us through the social and economic recovery, to improve our resilience as a society and improve our environment. The Catalan government response to the COVID-19 pandemic has focused on two main objectives. Firstly, and more urgently, to mitigate, of course, the effects of the pandemic on sensitive sectors in order to prepare the socio-economic reactivation of the territories. And secondly, to provide tools to ensure a better resilience in future crises. Sectors like tourism, energy, commerce, which are vital for many of us, especially in the Mediterranean area, have been deeply impacted by the crisis. The pandemic has also created major cross-country challenges for vulnerable groups and civil society organizations fighting for their rights. On both shores of the Mediterranean, the effects of COVID-19 have been harsher on the health, social, and economic situation of people suffering from systemic discrimination and inequalities such as ethnic minorities, older people, women, prisoners, homeless people, people with disabilities, sex workers, and of course, we cannot forget, we cannot avoid mentioning, of course, the increasing needs and vulnerabilities of refugees and internally displaced and stateless people who were already enduring inhuman treaties in centers and camps in front of Europe's passivity. And please let me stop here 1 second, because unfortunately we have to lament the fire that broke out in Moria camp in Lesbos this morning, destroying the camp. Apparently women and children are evacuated and are on the streets. This is very, very, very severe. So I'm gonna meet with my team afterwards to analyze the situation and see how we can help in this very, very sad event and terrible event. We're convinced that solidarity, strong cooperation, and shared strategies at European level, and together with our southern partners, are essential to mitigate the impact of the COVID-19 on public health systems, economies, and societies. In this respect, I would like to highlight that within the framework of the Catalan Committee for Emergency Humanitarian Aid, the Catalan Agency for Development Cooperation has approved support for a value of 1.7 million euros for 11 humanitarian projects carried out by Catalan development cooperation organizations and also by multilateral bodies. To single out some of them, I would mention very quickly Morocco, where an emergency aid to fight COVID-19 aimed at the most vulnerable populations will be deployed. Palestine, where we are developing a program on food safety and health rights for people living in extreme poverty in Gaza, and a project on children protection for prevention of infection in the West Bank. Iraq, where a project to attend Kurdish population displaced by the war in Syria will be set up. And finally, we have also coordinated the delivery of feedstock for the pharmacological lab of Rabuni in Western Sahara. It has been said that we don't have the solution for the problems of the world in our hands, but we have our hands to change and transform the world. What I want to remark is that we must put our best, each one of us, to overcome the challenges we are facing today. We must understand that if we fail to do so, it will have an impact not only on us, but mainly on the future generations. We have the opportunity to overcome this crisis by applying new rules based on solidarity, cooperation, and global prosperity if we manage to transform our economic models, making them fairer, greener, closer to people, and promoting social justice and equality. I strongly believe that sharing our own experiences in spaces like this one and many others organized on the occasion of the 25th anniversary of the launch of the Barcelona process will provide us with valuable tools to learn, discuss, and hopefully find the most effective policies in each of our countries to ensure that nobody is left behind in this crisis. The price of losing this opportunity is something that we cannot afford. So let's make this change happen. Thank you again. Moltes gràcies a tots per la vostra participació i desitjo que tingueu un molt bon i fructífer intercanvi d'idees. Gràcies.
Okay, thank you very much. Moltes gràcies. Thank you very much, Ms. Nebreda, for your commitment with the Mediterranean and to paying special attention to the societies and people. Now I will give the word to Emmanuel Coenadria, who is the alma mater of the Euromesco network and the director of the Euro-Mediterranean Policies Department at the IEMed. Emmanuel, you have the floor.
Thank you, Josep, and good morning, everyone. I would like to join my voice to yours, Josep, to thank you all panelists and also viewers through Zoom, through YouTube. We're very pleased with the success of this event. It's a pleasure to chair these sessions. Some of you may be a bit tired of hearing debates on the COVID-19 or reading articles. It is true, there is a bit of a proliferation, but I think you will also agree that the pandemic is a moving target. So what we're aiming at with this first session is, like a post-summer updates on the situation in a number of MENA countries, more specifically on the socio-economic impact of the crisis. So that's we want to look into facts. We want to assess the impact. We want to look towards the future. As Ms. Nebreda pointed, facts are actually very important to us as a think tank. And you also may have read the EU global response to the COVID-19 communication in April. There is a specific mention of the importance of facts and of the importance to counter disinformation So this debate is also a very modest contribution to these efforts to focus on facts. I mentioned disinformation. Well, you will all know that there is also a lot of disinformation about the role of the major players and the response by the major players to the crisis. This is a bit, the geopolitics of COVID-19. And here I would come to the second session. Mr. Popovsky, who joined us some minutes ago, is the Deputy Director General of DG NEAR. He will be the speaker of the second session, enlightening us on the EU response. And here I would like to mention that we at the IEMed, we think that our role as a communication multiplier of what the EU is doing is very important, and we also see this event as a platform to inform our audience about the EU response. So that's it for me. Basically, in terms of proceedings, I think everyone is familiar with the rules. We'll have for this first session, five successive presentations, short presentations by our panelists that I thank again. All our viewers, as Joseph Ferre mentioned, are welcome to throw questions to them. Please use the Q&A section of Zoom, or also on YouTube. You can also use the chat in order to throw your questions to the speakers. So that's it. Maybe I will now like to turn to Joël Abdelrached, our first speaker. Joël, you are based in Paris. You are Lebanese. You are an invited researcher at both the École Normale Supérieure, right, and the École des Hautes Études en Sciences Sociales, and a fellow at Columbia University's Society of Fellows in Humanities. Joël, thanks a lot for joining, and the floor is yours.
Well, thank you very much for your invitation, and thank you, Emmanuel, for the introduction. Let me see if I can share my screen. Can you see the presentation? Emmanuel?
Not yet, Joël. If you can replicate the moves we tried out.
Right.
Now we can, Joël.
Okay, excellent. Okay, great. Well, thank you very much for your invitation again to participate in this important meeting. Lebanon, as you know, is probably one of the few countries in the world right now facing multiple crises of dramatic proportions, from economic, financial, and banking, to epidemic, to security issues, to humanitarian, first with the refugee crisis from the Syria war, to the recent catastrophic explosion at the port of Beirut. The latter has displaced at least 300,000 people and destroyed, among others, 4 hospitals, leading to a loss of more than 800 teaching hospital beds. That's half the bed capacity of Beirut, including 2 COVID-equipped intensive care facilities. So with this complicated backdrop of compounded crises, the alarming recent surge of COVID-19 is expected to put additional strains on the economy. So let me show you some slides. According to, it's not working. I don't know what's happening, Emmanuel. Emmanuel?
Yes.
I don't know what's happening. I cannot, the slide is frozen.
Okay, did you, now we can see, Joël.
I'm sorry for that. I don't know what happened.
No worries, no worries.
So according to the ESCWA's latest report, extreme poverty has increased, as you can see, from 8% in 2019 to 23% in 2020, and poverty from around 20% to 32%. In terms of unemployment or employment, the situation is also dire. Even before the epidemic hits, there were massive business closures in reaction to the economic crisis that has exploded in September 2019. Businesses had, in a matter of a few months, lost access to foreign exchange and to imports. Households faced limitations in accessing their bank accounts, and the volume of remittances decreased due to the oil crisis in the Gulf countries. On the graph, you can see the dramatic impact on businesses in terms of decrease in sales. In terms of salary cuts as well, more than half of the companies had to reduce their workforce, and more than half had to cut the salaries of their employees. So the situation is pretty dramatic. Now, the catastrophic blast at the port of Beirut, which occurred on August the 4th, will further deteriorate the situation. As you know, the port of Beirut played a crucial role in the economy and was a hub of international transactions. Beirut, in addition, is the host of major economic activities in the country, mainly in the public sector, retail, and hospitality sectors. Now, the government has put together a less than modest economic package to try to offset the impact of the shock of the COVID crisis on the population. And that's before the additional financial strains resulting from the Beirut port disaster. The Social Affairs Ministry announced the launch of an aid program for about 200,000 families registered in their own registry of the National Poverty Targeting Program, although no further detail has been revealed. This social safety is far from meeting the needs of an increasingly impoverished population. Now we're counting over 600,000 households that are poor and that need assistance. And that's 3 times more the target set by the government, which, as you can see, is barely met. As for the Ministry of Public Health, they have estimated that their budget needs to increase by about 10% in order to pay for the $40 to $60 million estimated in extra health costs generated by the treatment costs of affected patients. Again, these were all estimates before the latest surge in cases and before the blast that caused an additional $25 million in hospitalization bills that have covered the wounded. Now, the World Bank project, the so-called Health Resilience Project, which is about $40 million, is supposed to strengthen the Ministry of Public Health's response to the COVID crisis by expanding the ICU capacity of hospitals and increasing the ability to test and treat cases. Finally, the government has asked banks to reschedule loans to small and medium-sized enterprises at low interest rates. The government has also introduced tax measures, which include suspension of tax deadlines, deferral of the payment of Social Security contributions, and recently they have rescheduled all the loans of destroyed businesses caused by the explosion. However, it's important to note that recently several syndicates, including those concerning tourism and small businesses, have rebelled against the state, defying lockdown measures, and have called for civil and fiscal disobedience. While the economic aid package of the government represents only about 1% GDP, as you will see, this is much smaller than similar efforts in Egypt, Jordan, or Tunisia. Currently, there is no fiscal space to finance this out of state revenues. So the package's financing will have to require printing money, which will end up inflationary, thus exacerbating the current macro conditions in the absence of external support. So international aid is becoming crucial. It is worth mentioning that the EU has provided, since 2011, more than 660 million euros in humanitarian funding to respond to the fallout of the Syria crisis in Lebanon. Following the Beirut blast, the EU has also responded swiftly by sending disaster experts, medical teams, chemical protection suits, more than 50 tons of medical equipment, as well as other critical items, food items, surgical kits, etc. And France, as you know, has been particularly involved and leading the humanitarian and rescue efforts. An international conference organized by France and the United Nations to support Beirut and the Lebanese people received pledges worth 250 million euros, with the EU being the largest contributor with 63 million euros. And more recently, the EU helped the main referral hospital for coronavirus, so for COVID-19 in Beirut, the Rafiq Hariri University Hospital, to expand its COVID-equipped unit by 6 beds to reach almost 30 beds. Of course, this barely compensates for the 20% decrease in COVID-equipped facilities that were caused by the blast. And finally, on his second visit to Beirut on September the 1st, the French President Macron pledged an additional 7 million euros for the Rafiq Hariri University Hospital, which, it must be highlighted, caters more specifically to the poor and refugees. So it's an important referral hospital. Now, all of these humanitarian pledges and aid are of course important, but it is equally important to emphasize that they are quite insufficient given that the needs are enormous. And indeed, the World Bank, in cooperation with the EU and the United Nations, has recently assessed the losses and damages to be in the range of $4 to $5 billion. So what's next? The country is entering a long and dark tunnel. There are lots of uncertainties as to the future. Lebanon is in a political impasse. There is no political will to make the necessary economic reforms. People have been protesting since October 17 to no avail. There seems to be wide recognition that corruption is endemic, but nothing is being done concretely to remedy this main hurdle to unlock more substantial aid from the International Monetary Fund. A new prime minister was appointed recently, but it remains to be seen if this government that hasn't formed yet will pursue a kind of business as usual approach or will push forward the much needed and long overdue reforms. So on this bleak note, I'll have to end, and I thank you for your attention.
Thanks a lot, Joël, for your presentation. I think one of the lessons of your presentation, and we'll maybe get back to this in the debate, is that also we are all affected by this crisis, as Elisabeth nailed on both sides of the Mediterranean. There are some pre-pandemic structural features in the case of Lebanon in particular, but also in the case of other countries that make it a bit maybe more challenging. You name it, the informal economy, the fact that some unemployment schemes are maybe not that structured in some cases, the fact that many households depend on day labor. So the question then is to know to what extent the crisis will be an opportunity to actually tackle those specific things. But let us go back to this maybe later on, and I will turn to Umayma Bourghiba. Umayma, you are a research assistant at the Policy Center for the Near South, a think tank that we know very well at the IEMed. Would like to thank you for joining. The floor is yours.
Well, thank you, Emmanuel, for your invitation. I would like to share my screen to show some figures. Can you see it, Emmanuel?
Yes.
Okay. So the Moroccan economy, like the many countries, hasn't been spared from the current unprecedented crisis. It is an unprecedented crisis because of the speed and the size of the output decline, because of the drastic measures, policy measures, and because of the uncertainty arising around the future of the pandemic and its impact on the global economy. So for the case of Morocco, locking down the economy in mid-March has affected many secondary and tertiary activities. And the most affected are those integrated into the global value chains with a sharp drop in foreign demand. For instance, in the second quarter of this year, the drop in foreign demand reached 18%. Such as in textile and automobile, which is the lead sector, export sector in Morocco. In the other hand, the tertiary sector has shrunk by 11.5%, reflecting the contraction of commercial and transportation and retail activities, which was also offset by the increase in telecommunication activity due to teleworking and remote education and so on. So in the third quarter, which is after the lockdown, the upturn of the commercial and manufacturing activities in this quarter the slowdown has been eased to 4.1% instead of 13.8% in the second quarter, and according to the High Commission for Planning, which is the official statistic provider in Morocco, 86% of firms who stopped their activities during the lockdown resumed their activities partially or totally during after the confinement. As a consequence, the unemployment rate increased from 8% to 12% between the second quarter of 2019 and this year. And of course, the main consequences were in the social and macroeconomic balances. For instance, the social balances have been significantly disturbed, and the crisis is hitting the most precarious and vulnerable population hard and could plunge more than 1 million of them into poverty. And informality in this regard is playing as an amplifier role in this regard. So the same thing for the macroeconomic balances, with an expected widening of twin deficits and public debts, of course. And the current account deficit is projected by the World Bank to widen to 8.4% in this year due to sharp decline in export, in remittances, in tourism receipts, and the overall fiscal deficit would widen to 7.5% of GDP. So, in coping with the current pandemic, Morocco has taken drastic measures in order to support many categories of its economy. So, starting, of course, by creating a special fund for managing the COVID-19 and an economic monetary committee. So, with the amount of 3.1 billion euros, 200 was allocated to health system in order to flatten the infection curve, and the other amount was allocated to support vulnerable households, either in the formal or informal sectors, in order to minimize the drop in consumption. And in the supply side, many measures like a new guarantee mechanism, demand oxygen for small and medium enterprises, and postponement of tax declaration and payments. The central bank and the Ministry of Finance has played a huge and big role in supporting the Moroccan economy. For instance, reducing the key policy rate by 25 basic points, tripling banks' capacity, and relaxing prudential requirements. Also, in accordance with Ministry of Finance, there was a reform in exchange rate regime with the widening of dirham's fluctuation band from 2.5 to 5, and also we use the PLL from the IMF with the 2.5 billion euros and the line of the World Bank. Also, there is, in the fiscal policy side, there has been reallocation of budgets to expenditure to health sector and exceeding the external debt threshold, etc. So all of this has as goal to mitigate the impact on the current account, strengthen the international reserve, and all these measures have one main goal, is to flatten the recession curve. So, of course, with all these measures, European Union has supported the efforts of Morocco by allocating 450 million euros in different fields, mainly health sector, education, competitiveness, and it was 115 was allocated immediately, and the rest will be allocated later. Also, the European Investment Bank has provided a loan of 100 million euros in order to face the pandemic in general. And the European Bank for Reconstruction and Development has allocated 300 million euros for public enterprises in order to cope with the pandemic. So in terms of the future cooperation, which is the structural relationship between Morocco and the European Union, the systemic nature of the current crisis has highlighted the over-reliance of European Union industry on China in many fields, where many firms were tempted to low production costs and skills in several areas, and the debate on reallocation of is acutely raised, and major European Union industrial countries seek to boost autonomy and bring supply chain closer to home. So this current context has revealed a necessity to strengthen the cooperation to increase the resilience of both partners. In this regard, Morocco and the EU discussed a new partnership opportunity in the wake of the corona pandemic. And for this regard, Morocco has proven its ability to adapt to new market demands and also preparing for a new industrial policy. It is also capitalizing on its potential not only to guarantee its sovereignty and protect itself from the risks surrounding the international markets, but also to become internationally competitive. And for example, I will give an example which Morocco was very which known by this example. Morocco has been able to produce a protective masks on large scale, amounting 7.5 million per day, and 8 million masks was exported worldwide. So this is the example for the ability to satisfy the new market demands. So in addition, the two partners are building on common environmental goals. They share the same path in this issue. Morocco is building on COVID-19 crisis and aims to accelerate its ecological shift. And EU wants to decarbonize its industry, but also in its imports. So it's a good point to share between the two partners. Also, all of these partnerships and opportunities that the two partners are willing to do will be acceptable and will be very present by accelerating the deep and comprehensive free trade agreement that was launched in 2013, and to actually sign it and to include the implications of the coronavirus pandemic. So I will stop here and thank you for listening.
Thank you, Maima. Very, very interesting as well. You mentioned some specific sectors. I think in our audience, we have some people from various tourism agencies, and that's maybe something also interesting. And another point of comparison, I mean, there is tourism sector plays a major role in Catalan economy. It plays a major role. I think it contributes like 16% to Moroccan GDP. So maybe in the debate, we can go back to this specific sector. Let us maybe now move a bit east in the Maghreb to Zied Boussen. Good morning, Zied, and thanks a lot for joining us. You are based in Tunis. You are a research fellow for the Arab Reform Initiative, another very close partner also in the context of UNESCO. Thanks, Zied. The floor is yours.
Thank you, Emmanuel. Thank you for all other speakers and for the presentations. So the figures and the data about Tunisia will be probably very close to what you have seen and what you heard about Morocco so far. Let me go back to the situation first. I will share my screen. Here it is. Can you see my screen shared, Emmanuel?
Yes, it is.
Okay.
It is.
Cool.
Yes, now.
So few information about what happened in Tunisia. So the first case tested positive was in March 2nd. I think, if I'm not mistaken, on the same day as Morocco, the same day first case was tested. We went through general confinement of the population from March to mid-June 2020. and borders were closed, of course. And most people here, most researchers, and even public representatives and officials tend to consider this first wave from March to June 2020. We had a very low number of positive cases compared to other countries, to EU countries especially, because up to June we had only around 1,000 cases tested positive and about 40 deaths. On June 27, that's the most important date, I think, in this. We got to, or Tunisia reopened borders to almost all countries based on a color code, like in other EU countries. But we had a lot of debate around this color code because most people saw those colors as based on political criteria and not on health criteria. So the second wave started around a week, 10 days after the June 27. In almost a month and a half, we went from 1,000 cases to 5,000 cases, a little more than 5,000 cases today, over 60 deaths. So we can safely say that we are going through a second wave of COVID-19 in Tunisia. That had a tremendous impact, especially the second wave, and of course the general confinement of the population, tremendous effect on the macroeconomic stats of Tunisia. You know from 2011 that the country is going through a latent or continuous economic crisis, but 2020 will be by far the worst year for the Tunisian economy. GDP fell, as you can see, growth fell by 21% in the second quarter of 2020. I tried to gather data. I have a lot of other data I can share with you at the end of the webinar. The unemployment rate reached 18%, sorry, in the second trimester of 2020. It's almost 2.5% growth or increase compared to the year before. There's a figure we tend to use here just to give you an idea on how many people are all today unemployed. As you can see on the upper part of the slide, almost 750,000 people are today unemployed. That's basically around the same figure of people employed by the public sector, the public administration in Tunisia. 88% of companies experienced a decrease in sales during the month of April. That's a tremendous, huge figure, and that's only for April 2020. In May and June 2020, 35% of active companies said they directly face a risk of bankruptcy or closure by the end of the year. And 3/4 of companies said they will probably, or they face risks of not being able to cover their expenses with available funds by the end of the year. There's another aspect of this crisis that is impacting households. More than 1/3 of the poorest households reduced the quantity or declared reducing quantity or quality of food items during the confinement, and almost 2/3 of the households consider that their financial situation has deteriorated during or after the general confinement. I will stop sharing this and keep on with the presentation itself. So these are the figures about or let's say macro figures, macroeconomic figures for Tunisia. What we have to bear in mind related to these figures is that maybe unlike Morocco or unlike other countries in the region, Tunisia is also facing a tremendous political crisis maybe the biggest since 2013. So for almost a month and a half, we didn't have a running government. The government resigned for corruption doubts. But now we have a new government, and for all the beginning of the second wave, the country was not led by a coalition or any standing government. To this political crisis, to this instability, we have to add the security threats. As you may have heard during the weekend, we had another terrorist attack, Allah yarham al-Jundi al-Itwafa, so one soldier or one police officer, actually a National Guard officer, died in the attack. This last attack in last weekend is the 20th terrorist attack Tunisia faced since January 2020. Most of them were targeting soldiers, but these are only the ones that happened, and the amount of terrorist attacks that have been successfully stopped is even bigger. To these political and security threats, to this economic crisis, to the health crisis, we should add a social or socio-economic crisis. We are witnessing severe impact of COVID-19 crisis and general confinement on the weakest categories of population. Vulnerable categories of the population are getting poorer, are getting even more vulnerable. We have seen during the last months how women in the agricultural sector were the first to be put on leave by companies or entrepreneurs. We have seen how migrants, and this is a topic I work a lot on, how migrants have faced a severe drop in the quality of services, or even in the mere access to health services in the public hospitals in Tunisia. LGBTQIA+ community and people also declared facing a lot of problems on a professional side and in terms of having access to health and social security support from a lot of our partners. To this, the Tunisian state announced in March many measures, especially financial measures to companies and to households. I can give you access to the figures, and you can come back to the debate on these figures during the debate. Also, the EU committed to supporting Tunisia's efforts by allocating an envelope of 250 million euros for the next period to come. The announcement was made in March. For both the Tunisian state and the EU Commission, so far we don't have the details of what has been spent, so it's a little hard to give a precise analysis of how budgets are being allocated. But in terms of measures, the Tunisian state also took same measures or very close measures to what have been done in Morocco. So we're talking about reallocating budgets, we're talking about key policy rate revised, to social security contributions suspended for companies, to taxes declaration suspended also for companies. So this announces a really huge challenge for Tunisia for the next period to come. And again, bear in mind that in next January, we will celebrate the 10th anniversary of the revolution. And so far, at least on the economic side, figures are not pushing for hope or not giving us hope. Thank you, Emmanuel. I'm happy to discuss further this topic during the debate.
Thank you, Ziad. Maybe one also interesting point regarding Tunisia is the consequences of political volatility and the changes of government. In general, we all know that the EU is not operating in a vacuum. Whatever it does is relying on the sense of national priority strategy. So in the case of the COVID itself, maybe the question would be, to what extent this change of government is also affecting the general line in terms of the strategy for the response to the pandemic. Let us move. We have 10 minutes left before we move to questions, so let me kindly ask the two remaining speakers to be concise. Let us move to Shams. Shams, you are a research assistant at the Palestinian Economic Policy Research Institute. Thanks a lot for joining. The floor is yours.
Thank you for having me. Thanks for introducing me. I don't have a presentation, I'm just going to talk. So first, I just want to start with talking about how the pandemic and the crisis have played out so far. Like most other countries, we had our first rise in cases in early March. We went into lockdown until mid-May, end of May, and then it gradually opened up around June, and then we saw a really big rise in cases that hasn't stopped. So as of this morning, there's approximately 35,500 cases in Palestine, and this number increases daily by about 700 to 800, even though we are basically open. There's some restrictions in place, but there's no real lockdown at the moment. The effect is not on the economy. The GDP has decreased by 4.9% after the first quarter of 2020 compared to the last quarter. The GDP per capita also decreased by 6% compared to the previous quarter. The public debt of the Palestinian government reached $2.9 billion by the end of May, compared to $2.6 billion May of the previous year. From between April to August, the Palestinian government was unable to pay salaries to civil servants in the public sector, as well as pensions. Unemployment has also increased, especially in Gaza. In Gaza, unemployment has reached 46%, which is one of the highest rates of unemployment worldwide. So about how public authorities have tried to mitigate these effects, there's been a number of policies enacted by the Palestinian Authority to mitigate it. However, I feel it's important to point out that the Palestinian government has limited space and capacity for response compared with other countries. Like it cannot control the currency or the exchange rate or any of these policies that can be enacted. We are limited by Israeli control, and there's been the recent ending of coordination with Israel, which means the government has stopped receiving tax clearance revenues, which has caused a further deficit in their budget. That being said, there have been some policies enacted. The Palestinian Monetary Authority launched a sustainability program that provided financial aid to small and medium enterprises and micro projects harmed by the crisis, with a budget of around $300 million, which would allow the enterprises to access funding at low interest rates. The PMA also announced a reduction of the charge for declined or bounced checks due to insufficient funds after complaints by chambers of commerce and businesses and individuals that they were unable to meet their obligations. One big initiative was a solidarity fund called Waqfat Aiz, which collected donations from the private sector as well as individual citizens locally and abroad, with the aim of using this funding to aid the Ministries of Social Development and Health in dispersing financial aid to vulnerable families, approximately 75,000 that were affected. As of June, the fund dispersed 500 shekels, which is around $150 for 18,000 families by June. Regarding the role of the subnational authorities, I think they had more of a role in societal organization and spreading awareness and more local campaigns. As I said before, the reach of the central authority is limited, so the reach of the subnational authorities is even more limited. So they worked on more spreading awareness and creating campaigns at more of a municipal, local level. Regarding the support from the EU and how it's been perceived, the EU has provided support to the Palestinian government since the beginning of the crisis. It gave an assistance package of 71 million euros to support fighting the pandemic, and it went towards healthcare, small to medium enterprises, vulnerable communities, and humanitarian aid. The EU also contributed 23 million euros that partially covered the unpaid June salaries of the civil servants, the unpaid salaries that I mentioned before. They'd also contributed 38 million euros that also went towards the April unpaid salaries and pensions. The EU also provided funding to the Ministry of Social Development to pay allowances for vulnerable families, and it also doubled its financial contribution to the Ministry of Finance. Now, regarding their perception, however well targeted and appreciated EU financial support may be, it is still not sustainable and it's not really a solution. Palestine's in a unique position in the current worldwide pandemic and economic crisis, and the government has less power and reach to respond with effective programs. Aid and support does help, but it does not fill the massive financing gap that we are currently facing or end the occupation powers that limit Palestinian sovereignty and exacerbate the economic crisis and the pandemic in the first place. Regarding what's coming next, so the virus is continuing to spread at increasing amounts daily, which is straining the healthcare system. Schools have opened, so it's affecting education. Businesses are running at a lowered capacity, so the economy is still being harmed, etc. So we're still seeing the virus spread. We are also under the looming threat of annexation, which was announced not too long ago, and still facing an increasingly hostile climate from Israel, with increased home demolitions. Since the start of 2020, Israeli occupation authorities issued about 650 demolition orders against Palestinian facilities in occupied Jerusalem. Up until about a week or two ago, Gaza was getting air raids almost daily. And Gaza was also on lockdown, so it was even worse. And they faced restrictions on fishing and on the entry of fuel. The only power plant shut down. All these things. Also, settlements are continue to be built without stopping or slowing down. So what's coming next is that we see a continued spread of the virus and a continued hostile environment and potential annexation. Now, regarding whether the lessons learned from the pandemic challenge the orientation of cooperation with the EU, I don't think they necessarily challenge the orientations, but I think they rather push for increased support and a more active role and potential reallocation of funding in the face of a hostile environment, regardless whether annexation happens or not, because even if it doesn't happen, it's still a very hostile environment. The EU should take a more active role in sending up to things like settlements, home demolitions, and maybe reallocate funding to more urgent social needs. After America cut its funding to UNRWA, a lot of EU countries stepped up their donations. So I think there need to be similar moves that take responsibility and increase and potentially reorient the kind of support that's offered. Thank you.
Thanks a lot, Shams, for your contribution. Let us finish with Shireen. Shireen is the director of programs of a prominent Jordan think tank called WANA. Shireen, the floor is yours to end this first round.
Thank you so much for this invitation, and I hope I can be as concise as possible. The situation here in Jordan is bleak, however, a little bit less bleak than what I've heard, of course, in Palestine and neighboring Lebanon. I'd like to share with you how we approached COVID-19 and how it affected the Jordanian economy. In deciding their responses to COVID-19, many governments had to choose between overwhelming their hospitals and saving their economies. In Jordan, the Minister of Health estimated that the cost of quarantining an individual was around 178 euros per day, and that the cost of treating an individual was around 1,680 euros per day. And with limited hospital beds and no guarantees that more equipment could be provided in the case of a widespread outbreak, Jordan chose to shut down its economy. On March 19th, less than 3 weeks after the first patient arrived in Jordan from Italy, the government closed its borders. The next day, imposed a nationwide curfew. The policy response in Jordan has been characterized by a preemptive approach to the suppression of an outbreak. The policy-making priority thus far has largely been public health. Defense Order number 2 did not allow citizens in all parts of the kingdom from moving outside of their homes. The order also stipulated the closure of all shops across the country and put into place a maximum prison sentence of 1 year for violators. Days later, the government tried to distribute essentials like bread, water, infant formula, and other things to the homes, but this initiative proved to be logistically difficult, so they had to allow some activity. So Small shops, grocery stores, supermarkets, bakeries started opening up from 10 a.m. to 6 p.m. And they became the vital lifelines in the economy. Jordan then started going through incremental stages in which certain businesses could operate during the daylight until June 6, when the government lifted the curfew. So 2.5 months of complete curfew and lockdown had a strong impact on the Jordanian economy. According to a study conducted by the ILO in May, the median monthly income prior to the lockdown was approximately 433 euros. In March, it had fallen to approximately 253 euros. According to the same study, 9% of Syrian households and 8% of Jordanian households actually had savings. The studies showed that 28% of households in Jordan have only enough money to support themselves for 2 weeks. Thus, the rest of the time, they had no income. Jordan put in laws of protection, surely, prohibiting employers from firing workers and reducing their pay. At the same time, supplying essential supplies, many protective issues. However, still, it was devastating 2.5 months. So which sectors of Jordanian workforce lost out the most during those 10 weeks? To get a better picture, we can look at the Jordanian workers in terms of formal and informal workers. 46% of the Jordanian workforce is comprised of informal workers. They are the day laborers, the farmers, recycling collectors, second-hand dealers, home-based businesses. Together, this segment provides 1/4 of the country's national income. The informal workers tend to have no written agreements and thus no benefits, and they were hit very hard. This meant that the informal sector were highly vulnerable to the effects of the shutdown. Although it is difficult to assess how many informal workers lost their jobs in Jordan, the UNICEF also provides an estimate. 68% of working Jordanian households reported that the outbreak of COVID-19 had affected or disrupted their work. 56% of these lost their jobs after the lockdown. As for those who continued to work, I would have to say many were receiving less than the minimum wage approved by the Jordanian government. Despite all these hardships, some surprising dynamics were revealed. Unlike, I can't remember, one of the respondents was talking about women being more affected. In Jordan, apparently, women were less affected because they were working in they work in more vital jobs like childcare, and they were teachers working from afar, so they were less affected. And I have a percentage here: 21% of females had been permanently dismissed from their workplaces, compared to 29% of males. Jordan's policy of closing its borders and imposing lockdown measures has resulted in Jordan's relatively low infection and death rates, the lowest in the region, actually, and one of the lowest in the world. The crisis could be an opportunity for the government to regain the trust that they have lost. Still, the effect of the lockdown has had major effects on the Jordanian economy, despite the spike in cases in the past 2 weeks. As we slightly opened up the economy. The airport was opened 2 days ago only. So there's new movement, and we're seeing some more effects of the COVID-19. Nonetheless, Jordan has seen some creative initiatives to the issue, including the EU. So, for example, in August, the EU and Jordan and the EU Civil Protection and Humanitarian Aid joined forces with local NGOs to produce handmade creative face masks inspired by Bedouin patterns. So the EU tried to tweak many projects in order to meet the challenges. In April, the EU also proposed a 3 million macro financial assistance package to help limit the economic fallout of the coronavirus pandemic. A total of 200 million euros have been allocated to Jordan under the package. Also under the Regional Trust Fund in response to the Syrian crisis. Jordan is second after Lebanon in hosting Syrian refugees. So an additional 20 million were pledged for Jordan to help in health, water, and sanitation, hygiene services for Jordanians and refugees. So as the economy continues on its slow path to recovery, we must continue to keep a development focus on the welfare of Jordan's informal workers and must make sure they are equipped with the tools and resources to withstand any crisis with resilience and innovation. Thank you so much for this opportunity and looking forward to the discussion.
Thank you very much, Irina. I think we met our objectives to provide as many facts and figures as possible and thereby contribute to a fact-based debate precisely. So thanks to all speakers for this first round. And now let me turn to the viewers and encourage the viewers to shoot questions to the speakers. I already have I think a question from a French viewer that somehow connects me to my point on the importance for international donors to rely on clear national strategies when it comes to the response to the COVID. That French viewer refers to an emerging debate in France that some of you may be aware of, that there is I think 40 billions of the European recovery plan that will benefit France, and there is a debate in France about who will really benefit from these amounts, whether it will be more businesses or more the vulnerable groups. So the question of the viewer is to all speakers, but whether there is a sense whether the support will rather benefit to businesses or more to vulnerable groups. So in other words, in the national strategies, is there a clear line of how the national and the international support will be used? Maybe Zied, you mentioned this both categories, businesses and vulnerable groups. Do you have a sense that there is a clear line in Tunisia on who should benefit first or in what proportions?
Thank you, Emmanuel. First, the line of the government, Tunisian government, was to mostly support businesses in the first half of 2020. But as I said in the presentation, that government is no longer in place, and the new government hasn't announced yet whether it's going to keep that line of supporting businesses or will it switch to consumption strategy or political line. I think that's an obvious answer I will give here, that we should do both. Our economy, especially companies or exporting companies, rely a lot on European economy, and as long as things are not clear enough there, we should, I think, support vulnerable groups. The INS, Institut National de Statistique in Tunisia, has drafted many reports since June on how vulnerable categories of the population are impacted, and that gives enough data for the government, for this government, the current government, to put in place mechanisms to support these vulnerable groups. But yes, I'm among the one who thinks that it's much more important right now to support vulnerable groups over companies, if we can do both.
Okay, is that debate resonating somehow to other speakers? Maybe others would want to reply to this. Joel, Shams, Sherin, or Umayma?
I mean, the situation in Lebanon is so complicated at the time, I mean, at the moment, and that they have lost legitimacy. So even their social safety net is not clear. I mean, nothing is clear. The line of the government is not clear. So it's, of course, I would agree that the vulnerable groups should receive aid, should receive the priority. But in Lebanon, for example, now with increasing poverty, we're talking about more than 50% of the population. And so it will all depend really on the legitimacy of the new government. So it's really at the heart of it, it's a political question in the end, even if there is a clear agenda of a public health strategy, which is not really the case in Lebanon. There is one hospital in particular that is getting most of the attention, which is the Rafi Hariri University Hospital, for good reasons. But still, the needs are immense. Their COVID unit is only 30 beds, which barely meets the needs of the population, especially as the country is entering a second surge, a very lethal second surge of COVID cases. Yeah.
I can talk about how it's being perceived in Palestine. I think, again, the important thing to stress is the lack of reach and the lack of capacity for response, whether it's for supporting businesses or for supporting individuals. I think there have been efforts on both fronts. I think there may have been slightly more efforts towards businesses, but I think the general feeling of people is that individuals are not being supported. What it is, the Solidarity Fund that I mentioned earlier has been the main thing that's like given direct support to vulnerable families, but even that is not that much. It's what, $150 they distributed in June for a family of 5. Where's that gonna get you? Nowhere. If that's what you get for a month. There have been efforts to help businesses, and the whole reason there is no intense lockdown now is because of the complaints from businesses and because of chambers of commerce. I mean, I don't think there's that much valuable and sustainable support for either. I think there may be a bit more of effort for the side of businesses. I think on an individual scale, people do feel neglected and forgotten about, those that have been affected by the crisis.
Okay, thank you. I would, if you agree, I will take I will get with we have many questions coming in. I will maybe read out 3 or 4 of them, and I will ask only a quick round of reactions to some of them, okay? And then we will move. We have Mr. Popovsky who connected himself. He was connected already, but he activated his video, so we'll move to him in 5 minutes. So let me just read out a couple of questions. One viewer is mentioning the role of cities, provinces, and regions in the response to the crisis, and is wondering to what extent has there been some sense of coordination between central governments and local governments. Another one is asking about how the COVID-19 pandemic has affected the citizens' trust towards the governments. Do people in the majority appreciate the government's decisions and measures? Do they rather reject them, or do they hardly care about them? And finally, do you believe COVID-19 will increase the economic pressure in a way that new mass demonstrations, he mentions Iraq as a reference, must be expected in Lebanon in particular? And the last 2 questions I would take at this point. I would ask you to, one is also related to the role of local governments, whether you think their contribution could be reinforced in order to meet the needs of the population. And another one refers to youth employment. Youth employment has been highly affected by this pandemic. Also, they represent the future of our economy. Any specific measures that have been taken by your respective governments to reboost youth employment? So let me turn to the speakers for a quick round. Please, it would be great if you could maybe react to some of this, and then we move to the second session. Should we start maybe by the reverse order? Sharon, do you want to react to any aspect?
Yes, the local government. Actually, in Jordan, I'm not sure how much you know about Jordan. It's very centralized. The government is very centralized, and it's been working for the past few years to decentralize and give more authority to the local governments and the different communities. However, we are still not there. Still, the local communities do not see their role as as taking more role. They see themselves as service providers mainly. That's what they've been doing for a very long time, and slowly, however slowly, they're getting there. So the COVID-19 is a great opportunity to work harder on this area. As for youth employment, I don't recall the number, but the number of businesses that closed down during the 2.5 months of COVID-19 that belong to youth is massive. So I believe that an interest should be given to the youth now in order to build up what has been destroyed. Thank you.
Shams, do you want to react to any question?
I mean, as I said before, considering the central authority is quite limited in its reach, so the subnational authorities are even more limited. Like I said, the only subnational campaigns were more safety campaigns on a local municipal level. There were at some points, when we were gradually easing the lockdown, that there were cities or municipalities that were setting their own lockdown specifically on their cities, or deciding to open up their cities while others were on lockdown. But no cities have done a big aid program. There's been small local campaigns or internal decisions about lockdown, but generally that's about as far as it goes.
Ziad.
I also want to react to the local government aspect. So since the beginning of the health crisis, municipalities in Tunisia, and just a quick parenthesis here, the reform of decentralization in Tunisia started with the constitution in 2014, but really was put in place in 2018 with the very first democratic election, local municipal elections. So we can only really talk about independent and autonomous municipalities towards the central state since 2018. But still in 2020, with the beginning of the crisis, municipalities here showed a tremendous power in terms of tackling issues related to the health crisis, especially the health crisis. So far, we haven't witnessed municipalities involved in tackling economic issues related to COVID-19. But especially during the last 2 months, and especially given that we didn't have a government in place, we saw many municipalities around the country taking the lead in raising awareness among the population, in imposing masks to the population, even though the central government didn't ask for that, in helping cleaning and public spaces and places where people gather. So we're seeing that municipalities, at least most of them, understood the challenge, understood that given the current political instability in the country, they can. It's the biggest opportunity given to them to take a place in this. But also related to that, they also faced a lot of legal void, given that laws and governmental decrees related to the 2018 decentralization law didn't or haven't been adopted by the parliament so far. So this is very interesting to see how municipalities will grow, will succeed or fail in building trust with population, in finding the place beside the central government in terms of public health management in general.
Thank you, Maima and Joel.
Yes, I would like to talk about the trust issue that was one of the questions. Well, in Morocco, the pandemic highlights the crucial role of the states in protecting and prioritizing the health of its human capital. So first, it was tackling the most vulnerable categories, and then businesses and small and medium enterprises in order to protect jobs, etc. And so I think that this current pandemic could be an opportunity actually in order to restore the trust between the citizens and the states for for more inclusive and a responsible society. Thank you.
Thank you, Joël.
Well, I may be repeating what Umayma just said, but I think it is crucial to underline the fact that transparency and trust are at the heart of any successful public health strategy, be it in Europe or elsewhere, or even more so in the Southern Mediterranean countries. And Lebanon is at a historic critical juncture. So either it heads towards a total collapse of the state, meaning total economic, political, civil, and including health and sanitary collapse, or the ruling class decides to seize the opportunity to undertake these long overdue economic and political reforms to put back the country on the right track.
Thank you. That closes the first round of this event. Thank you very much. Thank you for all viewers. There were many questions. Let me remind the viewers that there will be a chance to turn another round of questions to Mr. Popovsky, whom I'd like to welcome. Thanks a lot for your time, Mr. Deputy Director General of DG NEAR. You are in charge in particular of the Southern Neighbourhoods. Now, the aim of this second session would be precisely to look into the EU response to the COVID-19 in the Southern Neighbourhoods, and also with the underlying question of whether, to what extent it affects the broader EU's approach towards the neighbourhoods. Director Ferrer at the beginning mentioned the financial framework and the NP. I think the EU is used in taking into account emerging policy concerns, migration, terrorism, but in this case, I think it's very specific because it's really across the board. So I guess a major challenge for the EU. Mr. Popovsky, the floor is yours. Thank you again.
Thank you, Maro. I think I lost you for a second, but I hope that you can hear me. It's good to see you. Thank you for the invitation. I would start by just referring to the broader context that was mentioned at the beginning, and that's the 25th anniversary of the Barcelona process, which in a way put the Mediterranean on the political map. Has always been there, but I mean in political sense of the word, it has become more prominent in EU's external policies, and I would say that the crisis simply once again underlined the COVID crisis, of course, the strategic importance of the Mediterranean and the very close links with Europe, not only in terms of the direct effects of COVID, I mean epidemiological effects, but the longer term effects on Europe. The analysis of the speakers in the first session, I mean, concerning the situation in individual countries, actions taken by respective governments was spot on. So I don't have much to add. I don't have any alternative facts to offer. It's the impact is huge. We don't know all the details yet, but of course the impact of the crisis was huge on public health, but also on citizens' well-being, on the society, the societal trends, and of course the economic performance. So we need to take that into account as we go along, rolling out what we decided to do collectively back in April. So, and that brings me to the EU's response. And I think right at the very beginning, our policy paper communication, as we call it, of 8th of April, was mentioned. The communication on the global EU response to COVID-19, where we set out what we call the Team Europe approach. So a joined up policy by the European institutions, member states, and the EU, the multilateral and national development banks, like the European Investment Bank or EBRD. And that was the only way to deal with such a complex situation worldwide. Of course, I'm going to focus specifically on the southern neighborhood. So we wanted really to make use of all the tools that we had and to reorient our work with the neighborhood, in the neighborhood countries, to cope with the consequences of COVID. And so what we had in mind was, first of all, to respond to the emergencies. And some examples were given by the EU, providing protective equipment, for instance. Then we also wanted to strengthen the health institutions in the affected countries, which is sometimes short-term and sometimes mid-term, depending on the situation. And then we really try to devise our response in order to mitigate the medium to longer term social economic impact of the pandemic. But we also use this framework as a tool to link up our policy in the region with the major priorities of the European Union that were defined at the beginning of the mandate of the von der Leyen Commission, which is the European Green Deal, it's the greening of the economy, the digital agenda, and the economy that works for the people. Because these objectives are in common. I mean, we share. I mean, there is no major difference. We all in this together. And a healthy and stable neighborhood, neighborhood that has a green agenda, neighborhood that is going digital, is certainly in everyone's interest, not only in ours, but also in the countries concerned. So what we did following the framework, we basically reoriented all our assistance. So doesn't mean that we dropped everything else. And so there are certain things that we need to do anyway. But we try to reorient our cooperation programs with the more specific focus on measures to counter the pandemic and its impact. The numbers are telling. I mean, all of you gave examples of your respective countries, so I'm not going to repeat it because that would be a bit confusing, I think. But we, in the southern neighborhood, we decided to reallocate over 2.2 billion euros of existing bilateral and regional funds, mainly offering grants, not exclusively, and there are also some loans at favorable conditions, but mainly grants. And the idea was also not to add or not to limit the fiscal space. So because some of the countries in the region already cope with high debt rates, so we didn't want to add to that. But I'll come back to that in a second. So the immediate needs that I mentioned, so the emergency response was relatively small compared to other regions. It's about 18 million euros. But then the strengthening of the health sector was 888, and the support to the social economic recovery was up to 1.3 billion. So it was quite substantial. And now we are in the implementation phase. So the work is not done. Clearly, we still need to deliver on what we decided to do. I will flag a couple of examples without going into all the details, but with regard to capacity building of the health institutions and health authorities, we mainly work through the European Center for Disease Control, which is the Center of Excellence, one of our agencies. And they are able to operate in the neighborhood and willing to do so. So now they are fully engaged. Then we proceeded with budget support in some countries. What was not possible in all the countries, but the budget support disbursements were accelerated to answer to the exceptional budgetary needs, and that happened in Morocco, Tunisia, Jordan, and to the Palestinian Authority through the so-called PEGAS mechanism. And actually, it was then complemented by macroeconomic financial assistance by the European Union, also offered to a number of countries, which is not a grant, so it's not budget support as such. It's a loan, but it offers quite a lot of flexibility to the governments, because they can use it for different purposes. And we also thought that it was the right thing to do, to top up and to speed up budget support operations, so that countries can simply get access to liquidity at a time when they needed it most. And a good example was our contribution to the special fund set up in Morocco that was presented by one of the previous speakers, the Fonds Spécial pour la Gestion de la Pandémie. And that's going to continue. Well, that's for the immediate future, actually. I mean, the disbursement of other tranches of the budget support. But then, of course, in order to be able to deal with the economic and social challenges, we aim to increase support to small and medium-sized enterprises, again, by providing liquidity and interest in credit lines in the first place, and by stepping up our cooperation with financial institutions, both European, that I mentioned before, and international, like the World Bank, so that they can strengthen a number of regional facilities to support enterprises and entrepreneurs and financial intermediaries' evolving needs in the current context. And last but not least, indeed, we never lost sight of the refugees, migrants, vulnerable, and so we used our trust funds, actually the one for Syria and the one for North Africa, which is specifically focusing on migration, to provide emergency, but also mid to long-term assistance to the most vulnerable. So we delivered quite a substantial amount of funding for emergency medical assistance, for distribution of hygiene kits, but also support to basic health services and infrastructure, social protection, support to victims of sexual and gender-based violence. And there was a wave of that kind of violence during the pandemic. And this is continuing. And by the way, we also stepped it up after the Beirut blast. So we offered immediate assistance to the Lebanese people, but also to the communities, host communities, where a lot of refugees from Syria happened to live. And this is kind of assistance that benefits both the host community and those and the refugee population mostly affected. So looking at the future, we are now moving into the next 7 years budget. We are not there yet, so the negotiations on the details of the next multi-annual financial framework are ongoing, but the broad parameters we know, because they were agreed by the EU leaders back in July. When devising our cooperation with the countries in the Southern Neighbourhood, we'll certainly try to link it up with the anniversary of the Barcelona Declaration that I mentioned before. We can once again look at the objectives, look at the main priorities, and follow the logic that we also apply in Europe with regard to the recovery, the post-COVID recovery, namely the logic of build back better. So let's focus on the resilience of society and the resilience of economy. And indeed, this post-crisis, we are not in the post-crisis mode yet, but the post-crisis situation would be an opportunity to do things differently and to make this recovery sustainable, so that the economy can really deliver good results for the people. And we don't do it from an ivory tower in Brussels. I mean, we always work very closely with the countries in the region, and that's going to continue. We are now really thinking very broad terms about some kind of a recovery plan for the region that we could then deliver through the tools that we have under the new multi-annual financial framework, including the new cooperation instrument and the ICI. Still a complicated name. Hopefully we'll be able to change it so that it's more readable and more user-friendly. And this is, we are at that reflection stage as we speak, and all the impulses and the ideas coming from you are timely and very useful. Thank you very much.
Thank you very much, Mr. Borowski, for your contribution and explanations. Let me now open the floor to questions from the viewers. Maybe I will do a first round because I already identified 3 of them. One of them again is on the youth. The viewer explains that the youth were already exposed prior to the pandemic, and they're especially hit now by the effects of the pandemic. So the viewer is wondering what is being done in particular by the European Union, by the governments, to boost youth and employment and entrepreneurship in the region. So this is one. Another question, starting with an anecdote. The viewer was very pleased to see on the label clothing of a swimming suit of his son over the summer, a made in Tunisia label. The viewer is wondering whether it is completely idealistic or whether it is possible to envisage a reorganization of value chains for the benefit of Maghreb region. So in other words, would it be possible to reorganize the dependence of the EU from China and to relocate some industry and some production sites in the Maghreb region? And the third question that I have here is on to what extent the pandemic is challenging the approach of the European Union on the agenda of reforms. The viewer is referring to the constraints that will limit the margin of maneuver of budgets in countries such as Tunisia. These countries will need to postpone their reforms agenda. The reform agenda was one of the main leitmotif, one of the main discourse of the European Union. So to what extent the EU will need to revisit or reconsider its discourse on the reform agenda of countries such as Tunisia? So let me start with the 3 questions, Mr. Borowski, if you agree.
Yes, sure. So briefly on youth, clearly this is a priority, but again, this is something that we want to work on together with the governments in the partner countries. In some cases, for instance, this tool of budget support is actually quite handy because then they have a bit more space. They can decide where to put emphasis on and redirect some funding to employment programs or to support the sectors of the economy mostly affected. Some were mentioned before, tourism in particular, which is a huge source of employment in many countries. So another area that we certainly would focus on is education and vocational training. We are not starting from scratch because we've been doing that for a while, but again, maybe we have to be a bit more specific. I would also pick up the question concerning the relocation of some industries. I mean, I think this is very much in the center of this ongoing European discussion that many of you have followed. I'm sure about it, about the strategic autonomy of the European Union, which was in a way reinvigorated by the COVID situation and by the disruption of supply and value chains in Europe. So this whole discussion on strategic autonomy moved away from a purely security considerations, like military security, for instance, to the security of supply, to access to critical materials, and to the extension and protection of critical infrastructure. And indeed, there is this concept, which I think it's quite interesting, and we should certainly work on that, of some people call it near-shoring of some investment, so that we no longer depend on faraway countries. I'm not talking about one, but on other suppliers that are very, very far away, whereas at the same time, some of the production can be moved much closer to Europe's shores. And that could be beneficial not only for the European Union, but for the countries where the facilities would be then relocated to. And that could be very well the case in the Southern Neighbourhood. On the reform agenda, this is something that we really have to discuss. So as you know, with most of the countries in the region, with the exception of those in deep crisis or in a factual civil war situation, we have agreed a number of partnership priorities for a number of years, and now we are about to enter into a new period of programming of our assistance and cooperation. So we have to review them. I wouldn't say that the COVID has led to a radical overhaul, and now we will drop everything. And I mentioned that before, and then just focus on the immediate response to the pandemics, because there are many things that we need to do, whether it's water and irrigation or agriculture or the digital. But again, this is a process that will start now, actually these coming days and weeks, and that would hopefully lead to an agreement, well, if not by the end of the year, then hopefully as soon as possible in 2021. And we could also use this joint reflection with the governments, not only the governments, but also the civil society, entrepreneurs, organizations, and others, to underpin this logic of building resilience in the South. Thank you.
Good. We have a question from one of the speakers. So Joel, you have the privilege to have an access to a microphone. So maybe you want to formulate your question to Mr. Popovsky directly, Joel.
Yes, well, thank you very much. So my question was about the trade agreements between the EU and the Southern Mediterranean countries that have been criticized in the past for being too restrictive. So I was just wondering if there is an ongoing renegotiation or reconceptualization of these trade agreements, given the immense implications of the COVID crisis. Thank you.
Another question, if I want to regroup two of them, maybe it's a bit more technical. A viewer is wondering about the role of EU delegations in implementing the EU response. So what are, the viewer is asking what is the role and who are the main counterparts on the ground in the capitals when it comes to talking with the national governments on the COVID-19 response? Mr. Popovsky, do you want to reply?
So, I'm sorry. Yeah, I just pressed the wrong button. Look, trade is never easy, as we know, and the problem has always been, or the fact has always been, that the main commodities coming from the south are a bit sensitive. Whether it's olive oil or tomato pulp, we all know it. So it's we don't have that much leeway, not all the time, but of course this is very much on our radar. In some cases, the countries concerned decided to, I know of one of the case, to postpone the entry into force of some agreements already negotiated, because they have other priorities. And in some other cases, we continue with the discussions. We are not there yet. Of course, we should factor in the economic recovery. So the structure of the economy is as it is, and these commodities will continue to be quite competitive. But again, we are faced with some competition of our own producers, and our own producers have been affected as well. So that's a fact of life. So it's a bit of a balancing act, but I think this discussion has been reinvigorated by the crisis in a way. On the role of the EU delegations, it's key. I mean, these are our eyes and ears on the ground. Many of them operate in very difficult environments. I've mentioned the lockdowns. I know that colleagues, in particular in Amman, also to a certain extent in Rabat, have been in lockdown for quite a while, and still they continue to deliver. So they played a key role in devising our response, in this whole reorientation of our assistance, because they know how it works. They have the necessary network on the ground, and access to not only to the governments, but also to the people in need and to the professional organizations. I mean, all our necessary partners, and our model of cooperation is very much decentralized. So the delegations really manage the projects. And I, from my own experience during lockdown, I have to say that the delivery has even accelerated, because every week I had a special laissez-passer that allowed me to come to the office, because I had to sign more contracts than before because of the situation, and that we were just accelerating the actual delivery. And that was actually triggered by very intense work done by our colleagues in new delegations.
Thank you. I would propose we conclude with a final question on another viewer who is and I would read out, considering the massive toll of all Mediterranean economies have had to face due to the pandemic, but also the remaining ecological concerns that keep growing, what place remains for the shift towards sustainable tourism and the integration of South Mediterranean countries in Green Deal discussions? And I would propose we conclude with this one.
Look, the Green Deal, you can't do it in isolation. So in particular, when you look at the Mediterranean, and I remember the beautiful times of physical meetings. Last year I was in Barcelona, and there was at the launch of a study on the effect of climate change on the Mediterranean, which was really an eye-opener. I mean, because I've followed that as every interested citizen, but the facts presented by researchers were quite shocking. And this is where we are together. I mean, the effects may be more visible in some countries, or in territorial waters of some countries, but you can't contain them. So I think that it's imperative that we continue our work on the Green Deal, which we have to extend, and we offered to extend to our countries in the region. Then they are not under no obligation to follow the exact targets that were set for the European Union countries, but I think we are well. I mean, they will be well advised to follow the same logic. And I know that first of all, they're interested because they know what it means, and secondly, in particular with regard to the generation of clean energy, they have a huge potential. Towards the end of last year, I had a meeting. I met for the first time the head of the agency for renewables in Morocco, and presented to me the Zazawat solar plant. Quite impressive. And so, I mean, I'm not an expert in energy, so I cannot throw numbers at you of how many gigawatt this could generate, but the potential is huge for delivery of clean energy, not only to Morocco, but also to the countries in the region, also for export into Europe, and that's the right direction of travel.
Thank you. Unless there is any reaction from maybe the panelists here, I would like to conclude and close this event by thanking everyone, the viewers that join us in big numbers, the panelists, the secretary and the deputy director general, including. I would like to, maybe under the control of my director, to refer to the next edition of the dialogue that will take place on the 29th of September on rethinking urban resilience in a post-COVID Mediterranean. That will take place on the 29th of September, and there will be another edition of a Mediterranean Dialogue Plus 25 the next day on intercultural dialogue. So here we close the event, and again, thanks very much to everyone. I think it was very informative, and we met, as far as the IEMed is concerned, we met our objectives. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you.